morning, everyone, and welcome to today's webinar, Designing an eHealth Resource for Breastfeeding, an Introduction about Breastfeeding. My name is Andrea Bodkin. I'm a Senior Program Specialist at Public Health Ontario, and I have the pleasure of co-moderating today's session. I'm coming to you today from the PHO offices in downtown Toronto on treaty lands and territory of the Mississaugas of the Credit First Nation, Treaty 13, lands associated with the Toronto Purchase of 1805. Today, this area is known as the cities of Etobicoke, Toronto, North York, York, and Vaughan. These have been the historical and ancestral lands of many First Nations for thousands of years, including the Haudenosaunee, the Huron-Wendat, and most recently, the Mississaugas of the Credit. These people lived, hunted, traded, traveled, learned, and prospered on this land, and I'm grateful to have the opportunity to be here. I'm going to introduce my co-moderator for today, Dr. Karen Campbell. Karen is an assistant professor at the York University School of Nursing with a background as a public health nurse. She is part of the leadership team at PHN Prep, supporting evidence-informed resources for public health nursing in Ontario. Karen, thank you for being here today.
Thank you. It's always my pleasure to be here and to co-moderate with you, Andrea. I'm also really proud to be representing the work of PHN Prep and our team in supporting public health nurses, supervisors, managers, and home visiting staff in the work that they do with families. It's my pleasure today to introduce our speaker, Dr. Jennifer Abbass-Dick. Dr. Abbass-Dick has worked with perinatal families, both as a registered nurse and a lactation consultant in hospitals and communities throughout her career. She's dedicated to assisting and empowering parents to have a positive and healthy transition into parenthood. She's currently an associate professor at Ontario Tech University, where I also had the pleasure of working with her. Jennifer, I'm going to pass it over to you.
Thank you so much, and thank you so much for having me here today. And I'm really excited to be sharing my work with you this morning, and we are going to be talking about designing the eHealth resource about breastfeeding. So here's just a disclaimer regarding this particular presentation. And the learning objectives are to summarize the evidence informing the redesign of the website, identify and locate our new resources that aim to support breastfeeding health literacy, explain how these resources can be used in practice by public health nurses to increase breastfeeding health literacy, and describe the value of eHealth resources for breastfeeding health literacy and support. So, breastfeeding rates are suboptimal, and many parents have difficult, negative, stressful experiences with breastfeeding. Parents report receiving insufficient, inconsistent breastfeeding information, and knowledge about breastfeeding and where to get assistance is low among parents. Parents report being surprised when breastfeeding does not happen easily, and parents receive care from a variety of healthcare providers in different organizations over the perinatal period. How to best design breastfeeding education for use in clinical settings is not known. We do know that there are a number of effective interventions to support breastfeeding, and these include the Baby-Friendly Hospital Initiative, 10 steps. Systematic reviews have identified effective breastfeeding intervention components, and these should include both education and counseling, be provided repeatedly, span across the perinatal period, and involve women and their family members. Successful breastfeeding establishment requires a broader ownership by healthcare organizations who work with perinatal families to provide breastfeeding promotion and support programs. Technology is increasingly being used in the design of effective breastfeeding support interventions. We really wanted to expand on the concept of education, and we've adopted the health literacy approach because this is really about a shared responsibility and a partnership between healthcare providers and parents. And we have published a paper regarding this, and we defined breastfeeding health literacy as parents having access to credible information that they're able to comprehend so that they really understand the lactation process and are able to evaluate and analyze their own establishment and maintenance of breastfeeding and determine when support is needed and where to access support. And then they're able to communicate effectively with healthcare providers regarding their progress and while working to overcome any challenges they may experience. And ultimately, they're able to achieve their goals with knowledge, skills, and confidence. And when we looked at the health literacy frameworks and the breastfeeding literature, 3 different strategies were suggested that could be applied to breastfeeding promotion and support programs and interventions. And these are to provide accessible information in multiple modes. The second is to have continuous standardized information promoted throughout the hospital and community settings. And the third is to have healthcare professionals and organizations accountable for structured discussions and clinical interactions to validate parents' breastfeeding health literacy. And so our solution to the problem that I mentioned earlier is to implement a breastfeeding co-parenting eHealth resource in clinical interactions to standardize breastfeeding education throughout organizations in a health region that provide care to perinatal families. And this solution incorporates all 3 strategies. I wanted to just talk about how these eHealth resources have evolved and been developed over time. They started with my doctoral work, which was a co-parenting breastfeeding support intervention. This was a randomized control trial that evaluated this intervention. It did find that it increased breastfeeding duration, fathers' breastfeeding self-efficacy, and the support provided by fathers. We also asked the participants how they enjoyed working with the intervention, their satisfaction. They were very satisfied with being provided with comprehensive breastfeeding information, as well as co-parenting information, which enabled them to work as a team to meet their jointly determined goals. We also heard that they really appreciated having the research assistant review the information in the intervention with them and the reminders. After I finished this doctoral dissertation, I started to work with Durham Region Health Department. And I've been working with Durham Region Health Department and the public health nurses at Durham Region Health Department since 2014. And together, we took that intervention and created eHealth resources so that we could make this information freely available to people in the community. We did this when we were creating the eHealth resources in partnership with populations. We wanted to make sure it met their learning needs and was designed in a way that they would want to engage with. And so the first population that we worked with was couples, as we wanted to involve fathers and partners. We wanted to have content relevant to fathers and partners and have it designed in a way that would also speak to them. We also received funding to create additional versions. So we had a version created in partnership with Indigenous families, as well as younger mothers in the Canadian Prenatal Nutrition Program. And here you can see our initial versions of the eHealth resources. These were created with a software called Storyline by Articulate. It was a Flash-based product, and it enabled us to create an ebook. So we had the version for fathers and partners, the version for Indigenous families, and the version for young single mothers that had brighter colors and images of younger mothers. It didn't work as well on mobile devices, so we had an HTML mobile version as well. We conducted a randomized control trial. And in this randomized control trial, we followed women and their co-parents from prenatal to 52 weeks postpartum. And both groups were asked to work as a co-parenting team to meet their goals and to use generally available resources. However, study group 1 was given our eHealth resource. As you can see here, both groups had very high breastfeeding rates. Exclusive breastfeeding at 6 months was 63% and 57%, and any breastfeeding was 71% and 78% at 12 months. And you'll also notice that 91% of the participants had experienced breastfeeding problems. So, although we did not have a statistically significant difference between the two groups, the findings do illustrate that having the couples work with resources to meet their goals did illustrate that they were able to overcome challenges and they had very high breastfeeding rates. But when we looked at the intervention group and their satisfaction with the intervention, they were again very satisfied with being provided with this comprehensive resource that they can access at any time. They also appreciated having the research assistant go through it and let them know what to expect, what was in the resource and how they could use it. As well, they appreciated the reminders. And both groups indicated that they used websites most often when they were seeking breastfeeding information. After the randomized control trial was completed in 2020, we redesigned the website and we amalgamated all the different versions into one. And breastfeeding information for parents, breastfeedinginfo.ca, was created. And we wanted all of the populations to see themselves within this resource. We did this because the Flash-based software was no longer going to be supported on the internet browsers. It was also a little bit challenging to continue to update all of the resources that had the same information but were just packaged differently. So this was our resource at the time. And it provided information in a number of ways. So we had games, quizzes, ebooks, animations, illustrations. It also linked to other information on the internet. It had narrations, text information, and illustrations. And this animation here is on YouTube and has 6.7 million views. So it was created for the website and it's just about 40 seconds and it illustrates comfortable latching. So we knew that we had an eHealth resource that parents valued. We knew that parents value websites. And so we now wanted to look at doing more than just disseminating this eHealth resource. We now wanted to implement it. We wanted to have it implemented in clinical interactions. And so in 2019, we began to partner with Lakeridge Health as well. And so we had the team working together, and we now needed to hear from healthcare providers and have them involved in this implementation. And so we first surveyed the healthcare providers in both organizations. And what we wanted to know was about the barriers and facilitators and acceptability of using this eHealth resource in the clinical settings. And so 44 healthcare providers from the health department and the hospital completed the survey. And they indicated that the resource was of high quality with relevant information and content. It was evidence informed. They thought that everyone should be involved, all healthcare providers that work with perinatal families. However, they also mentioned that educational handouts and posters, as well as reminders, would really be of assistance in implementing this resource. And there were also some concerns around the amount of time it would take them to review the resource and determine how to use it in clinical practice. And this really spoke to the fact that, training or a cheat sheet, how exactly were they going to use the resource was really one of the things that we were identifying through this survey, that there was some need around how to help healthcare providers determine how to best use this resource. There also was concerns around the amount of information provided in the website, and they thought parents may find this overwhelming. And technical issues were also a concern when they were thinking about how do we use this in face-to-face clinical interactions. So as we were moving on with our pre-implementation work, we really were trying to determine how do we implement this in clinical interactions in organizations. So the questions we wanted to answer were, who will use the resource? What topics will they refer to? where, in which settings, when in the perinatal period, and how will healthcare providers use it. And in order to determine this, we really had to know what's currently being done. Who is providing this education? What topics do they cover? Where is the education given? When is it given? And how is it given? And so we really, again, had to step back and listen to parents and healthcare providers to really know what it is that's happening so that we could determine how to best implement this. So the first thing that we did was a design thinking session. And so we had healthcare providers from our partnering organizations, Durham Region Health Department and Lakeridge Health, come together. And we had a design thinking session, and it was facilitated by Julia Micallef and Dr. Adam Dabrowski at the Mac SimLab Health. And we also had 3 preconception women who were involved. And the aim was to understand the experiences with breastfeeding education and need for resources to support delivery of information. And this was to inform the design of anything that we needed to create to supplement the eHealth resource use in clinical settings. We had 2 3-hour sessions, and the first 3 phases of the design thinking approach to empathize, define, and ideate were explored. The key barriers identified were timing of breastfeeding education, accessibility issues, parents' lack of awareness of their need for breastfeeding education, and inconsistencies within the healthcare system. The proposed solutions were to initiate breastfeeding education earlier in the perinatal period, to improve resource accessibility through innovative tools, and to ensure consistent messaging, as well as adopting a wellness model for education. So we knew, again, we needed to do more. We needed to create additional resources. And we had to, again, step back and continue to listen to and hear from healthcare providers and parents. And so this led to the next phase of this pre-implementation work. And we surveyed healthcare providers. So 93 healthcare providers and 78 parents completed the survey. And we interviewed 10 healthcare providers and 5 parents. So our questions were designed to determine their experiences, barriers, and facilitators, and what they'd like to see created to provide breastfeeding education. And this was actually, we did get an REB exemption for this work. It was seen as quality improvement work. And so you can see here our healthcare providers the majority worked in the community. However, many also worked in the hospital. Most had worked over 10 years, and public health nurses were the group that was represented the most, followed by lactation consultants. However, there was quite a diverse group of healthcare providers represented. And in relation to the parents, all identified as mothers, 100% had breastfed, 41% had breastfed over 12 months. Some had done combined feeding, and some had bottle-fed breast milk. They ranged in the age of their youngest child, and most had 1 or 2 children. We asked them who had provided breastfeeding education and at what time points in the perinatal period. And you can see here that it is quite fragmented as to whom and when breastfeeding education is being provided. The majority of the education is being provided in the early postpartum period in the hospital. If they had a midwife, there was some consistency, and the midwives would follow them up into the early postpartum period. We had a number of open-ended questions, and from that, we were able to identify some of the challenges. So the quality and quantity of information from healthcare providers is dependent on knowledge, interest, and skill. Human resources allocated to breastfeeding education, as you just saw, are mainly in the hospital. There's limited access to professionals and information pre- and postnatally. Specialized lactation professionals have difficulty finding paid opportunities to provide care, and parents have trouble accessing specialized lactation professionals due to location, cost, and timely support. Here are some quotes from some of the mothers. I actively sought information from many sources throughout pregnancy and postpartum, and even paid for a lactation consultant. If I had have only used the information I received from my midwives or from the on-staff lactation consultant in the hospital, it would not have been enough. Another said, with my second baby, I was having a harder time with my milk supply and could not find a lactation consultant available to be in a reasonable time. Appointments were a few weeks out, when I knew it was important to get things going right away. I think that really hurt us in the long run. And another said, I was like that Googling person, of course, which was not necessarily helpful because all opinions are different there. But yeah, it was a lot of me seeking out information all over the place. So it wasn't very organized. We asked about topics covered. We asked about what topics and at what time points in the perinatal period. We were hoping to come up with about 3 to 5 key topics that we could use when we were looking at creating these additional resources for use in clinical interactions. But we found there was quite a number of topics. Healthcare providers were also asked what they discussed, and as you could see, again, quite a number of topics are covered. We asked how breastfeeding education was provided. As you can see here, there's some print material, some online material. However, oral communication is how it is most often communicated. And this was consistent with what the parents indicated. They had some classes in the prenatal period, and they used some print material and websites. However, oral communication was most common. So what were some of the challenges with what and how the information is delivered? Most information is provided in oral communication. There's a lack of consistency in delivery methods and topics, no standardized resources. Parents don't know they need breastfeeding information, which impacts their readiness to learn. Parents are overwhelmed by the amount of information, and healthcare providers are competing with information parents receive from social media, formula advertising, and misinformed healthcare providers, family, and friends. So, what is currently being done? Various healthcare providers are providing breastfeeding education, and they have differing skills and knowledge. Numerous main topics are covered, mainly in the hospital, some online and in the community, mainly in the postpartum early days, with some prenatal and postpartum, and oral communication is used with varied use of print and online resources. So we also wanted to know from healthcare providers and parents, what should we be doing? How should breastfeeding education be delivered? And so healthcare providers indicated it should be delivered across the perinatal period. And in relation to who, all healthcare providers across the perinatal period should initiate discussions about breastfeeding, and there should be seamless referrals and access to specialized healthcare providers as needed. When consistently across the perinatal period, started prenatally, as directly after birth is not conducive to learning. What should be provided? Information on how their body works and what to expect, awareness of what helps and hinders the process, unbiased information that enables them to explore different approaches to best determine how to meet their goals, and how information should be accessible in many formats, both print and digital media, standardized, credible, and updated, tailored to perinatal families, grandparents, friends, and the general public. And here are a few quotes. I felt as though in the hospital it was a rotating door of people. And it would have been nice to have someone come in and just give some nice overview to understand how the female body works and things that can cause issues. Another mother said, but definitely just more about normalizing everything that comes with breastfeeding. I know there's the general information, but there's a lot of stuff I think that can come with that. There's no right or wrong answer, black or white. And a healthcare provider indicated, give the information, but they don't need to learn the whole thing in one day. Don't overwhelm them, just so they know where to go later, who to trust, who to go to, that type of thing. And another healthcare provider indicated, I use a trauma-informed lens when discussing breastfeeding, as this can be difficult for some, so explaining their thoughts and feelings and experiences and what can be done to support them to help them be successful. in whatever that means for them. Mothers' perceptions of the most important topics. As you can see here, there's a number of topics that mothers thought should be provided in the education, and this span the perinatal period. And what did they want to see created? They did want print material. They also wanted online material, and they thought props could also be used. We asked healthcare providers in our survey to take a look at the eHealth resource, Breastfeeding Info for Parents, and we asked them if they would use it in clinical interactions. And as you could see here, 20% said that they wouldn't, but 80% said they would. And we asked them what adaptations would be needed. So they wanted it to be evidence-based, up to date, to align with BFI and provincial approval. They wanted QR codes to the website, print material. They wanted posters and handouts, access to technology, easy to use, user-friendly, promoted, short videos and presentations, and available in multiple languages. So, what is needed to adapt the resource to the local context? All healthcare providers who work with perinatal parents should be who this is designed for. We need to determine categories to organize the content so that it can be located easily and parents can then find additional information as they need, scaffolding of information, in all healthcare sites across the perinatal period. And so the eHealth resource would be introduced in oral communication with print resources containing information on topic categories that link to the website where more information should be found. And so this led to our development of our prototype. So I worked with the health department and a digital media communication specialist. And we had three main things based on all the work that we had done and all our pre-implementation work that we decided needed to be done with our eHealth resource in order for it to be used in clinical settings, implemented in across our region. And so those were to determine branding. And branding would enable it to be identifiable, and it would therefore be standardized information so that everybody was using the same information and it was clearly identified by families that this was part of consistent information being used. We were going to redesign the website and organize it into 5 main categories that were clearly laid out and easy to navigate. And having a wellness tone in the messaging was really important. And the next thing was to create handouts and posters with QR codes. So these would be used in clinical settings. They could be used for teaching and also as reminders. And they could be provided to parents where they could access them at home. This would increase the brand recognition as well as access to the website. So some of the things that we found that are consistent with what's in the literature was that we really were going to go ahead with using supportive messaging. And we really wanted to provide basic information so people understood lactation, but also encourage parents to ensure that they're able to access personalized support as needed. We also wanted to make sure that we created the resources for use in clinical interactions, so sort of having that multiple formats of print and digital. We want to be ensuring that we're decreasing the variability in both the quality and quantity of information provided so that we could create something that would make it so that regardless of who the professional was, regardless of their knowledge, skill, or interest, everyone was getting consistent, credible, and up-to-date information. And having it implemented in healthcare organizations is really important because we wanted to have this throughout the health region across the organizations so that we're developing an infrastructure for seamless specialized care availability. And it's also important what we found both in, hearing from the healthcare providers and parents that we have some accountability. Is this actually being provided to parents? So measuring fidelity and tracking information and support being provided is also something that is recommended. So here is our eHealth resource. that has newly been launched, and this is called About Breastfeeding. As you can see, this is our branding, About Breastfeeding, with our logo. The website is very clearly laid out with 5 topic categories, and we have a video reference library. So for healthcare providers, the video reference library is often very helpful because if you like to use videos in your teaching, you could just very easily access them there. On the Why Breastfeeding page, we have a number of topics, as well as how to breastfeed. In the What to Expect section, we have information for parents not only on establishing breastfeeding, but we cover topics that will be of interest to them throughout their breastfeeding experience to 2 years and beyond. As well, we have common concerns and how to overcome them. And we have information for family and friends on how to support breastfeeding. Additionally, and importantly, we have information on how to access support. And so this is really exciting because parents need to know where they can get help when they need it. And so 811 is actually across Canada in all provinces and territories. And so in Ontario, we definitely have 811 where parents can receive breastfeeding help and support. Additionally, we have this map, and on the map in each province, there is a website that the province is usually a provincial website where parents can access breastfeeding support. And so in Ontario, we have the link to the public health locator so that parents can put in their postal code and find out their public health unit's contact information. Here are our handouts, and this is what we've created to supplement the website. And so these can be used as posters in the clinical setting. We also could have them in the community, and they just provide an overview of all the different information available on the website. There's a QR code as well. And then there are specific ones. So for healthcare providers who teach breastfeeding education, oftentimes these would be the topics that you'd likely be teaching. Why breastfeed, how to breastfeed, and getting support. So it was really important that we had the information in print as well so that parents aren't just hearing the information orally, but they could also have it in front of them. They can have it provided to them to take home. And healthcare providers would have the information so that it's consistent regardless of what healthcare providers are providing it. We also created this this threefold, which is actually really nice because it does cover all the different parts of the website in a little bit of detail. And again, the main thing in relation to healthcare providers using these print resources is to get the families to scan the QR code and go straight to the website. And ideally, the healthcare providers will also know the content they teach and where it is on the website so that parents can get much more information than what's on these handouts. But the handouts are very helpful for use in these face-to-face clinical interactions. And here's on the inside of this threefold. So again, it has information on all the different topics on the website. This was just a poster that we sent out digitally in introducing our website. And I just wanted to mention it to anyone here who maybe hasn't had access to this, are introducing about breastfeeding, because a couple of things, there's a little video that describes how this can be used. It's 1.5 minutes. And then there's a survey that we do have, and it is currently on the website as well. And we are just collecting information from users regarding the content, design, and usability. So again, this is a very, very exciting partnership and project. And again, I just want to thank my partners that have been absolutely amazing in this project working with me. And we're really excited to be where we're at now with the launch of the website. I just want to mention it is being used internationally, and it definitely is being used across Canada. So back to sort of what we set out to do in relation to increasing families' breastfeeding health literacy, we wanted to make sure that we were addressing these strategies And so in conclusion, About Breastfeeding has evolved out of the research conducted with parents and healthcare providers regarding the design and delivery of breastfeeding education. And it's designed to increase access to standardized, credible, evidence-based, easy to understand, basic information on breastfeeding and lactation. And it's designed for all community members, which really aligns with strategy 1. It's designed to provide parents with information they need to meet their infant feeding goals and direct parents to information on where they can access professional lactation support in their community. So there's basic support, but there's also specialized support. And so I think that differentiating that is important. Supplemental resources are designed to assist healthcare providers in delivering breastfeeding education in a standardized manner to increase consistency and decrease time needed to teach basic material, enabling more personalized discussions with families regarding their current breastfeeding or lactation knowledge and understanding their needs to meet their individualized goals. About Breastfeeding is designed to provide information to be implemented in healthcare and community settings that expectant families access across the perinatal period and while breastfeeding during early childhood. So this addresses all of the strategies in relation to how to support breastfeeding health literacy. And so what are our next steps? We are currently going to be starting user testing. We're going to have focus groups with healthcare providers and parents, both expectant parents and breastfeeding parents. We have the survey, and we will be distributing the survey to ensure that we are collecting users' feedback. An advisory committee to standardize breastfeeding education nationally is something that I am working on. I am part of the Canadian Breastfeeding Research Network, and so we have a group that's working on standardizing breastfeeding education. Adaptations will continue to be done. We just had an adaptation in June. We just updated some content after quite a bit of consultation around the changes related to supporting mastitis and plug ducts. And there will be more updates. However, it really depends on funding. And so what you've seen here, we've been able to do with the funding that we have. Obviously, the more funding we have, the more we'll be able to create more videos, more animations, and more languages we'll be able to offer this type of resource in. If your organizations are interested in being involved in this research, please do reach out. If you're interested in being part of the evaluations or focus groups, or if you're interested in having the handouts and so that you can use them in your clinical setting, please contact myself. And I do want to acknowledge my collaborators, the team at Durham Region Health Department, with Kelly leading it, and Lakeridge Health with Calcilla leading it, have just been invaluable to the success of this project. All my co-investigators, graduate students, funders, and of course, our website designer. Thank you.
Thank you, Jennifer, for that excellent and insightful presentation. We're going to move on to the question and answer segment of the program this morning. And just a reminder to anybody that is in the audience, if you haven't already, please feel free to enter your questions into the question and answer, the Q&A pod. And with that, I'm going to open and ask some of these questions because there's lots that are rolling in. And I think some of them you may have just answered there at the end, but there's questions around for smaller health units where there's not a lot of funding or time that's allotted to complete any of the growth and healthy growth and development work. Is there ways that the health units can adopt to rebrand any of these handouts to make them specific to those areas?
So as you can see, I do this from a research lens, and I make them available because that's what I'm passionate about getting this information out there, and it's on the internet and always has been since we started. And so it's freely available, and I want people to use it. So as in my last slide, if you are interested, this is something that we can talk about. There are, I would just ask you if you're going to adapt it, we would just work together to ensure that that's done, but that's no problem. We can work together to do that. So just if you want to contact me at that email, we can talk about that if your health unit's interested.
That's fantastic. Another question was around the sustainability of it and who is monitoring it, who's keeping it up to date. How is that going to happen? What's the sustainability plan?
And as you saw there as well, it has been sustained since 2014. It does not take a lot actually to keep it as it is. If we want to continue to build and develop it, we continue to try to apply for grants or partnerships or people that are willing to put some funding into this, organizations, whatever it may be. Because it's out there and I'm working with so many different groups, we've had it evaluated numerous times, by the way. So we've had BFI assessors evaluate it. My clinical partners have the professionals in their organizations. We review it every 6 months. It's also so widely used that any problems that are happening, any changes, I'm made very aware of very quickly. So we, as I mentioned, were able to just update the content on mastitis and plug ducts and engorgement, and that was related to the breastfeeding protocols that had come out around that. So having this out there and getting everyone involved, we know that there were amazing resources available through Best Start for a very long time. So we want to continue to have resources that everyone feels comfortable using, because it really does help parents in the long run to have that consistency. I hope that answered that question.
That's a great answer. There's a number of comments saying wonderful presentation and wonderful lactation resources. One user is asking, participant, our health unit has made an effort to adopt gender neutral language in perinatal and lactation fields. And they're using language like parent, breastfeeding person, they, them, breastfeeding, chest feeding. Is there consideration to review the language that's used in these resources?
I think that we're always looking at what the needs are. As mentioned, this is being used nationally and internationally. So we want to ensure that the language that we use is as clear as possible for the majority of the population. But these are always things that we are looking at.
There's a few people that are asking for your email address to contact you, which sounds like a good thing. And Public Health Ontario has dropped that into the chat for anybody that needs that. Thank you, Tanya. There's another question around languages and adapting it to other languages. Is that a plan that you have?
So again, this has been done actually with you'd be amazed how much we've done with the amount of funding that we've had. So again, it would take a ton of funding in order for this to be translated. But if there is interest and funding available to do that, of course. Currently on the Visit Our Video and Reference Library, we do have links to websites that do provide breastfeeding education in other languages. So right away, the idea is that regardless of the healthcare provider the client, you should be able to find information to share with that client that would help them with their breastfeeding. So the thing that would be best is that healthcare providers take a look at the resource and think about what it is that they usually communicate in their breastfeeding education, and how can this resource be used for the reasons mentioned in the presentation, so that parents have access to this information once they go home, and they're able to access additional information around how to get help should they need it.
That's excellent. There's a few questions around navigating the website. Do you have any tips for navigating the website to get to some of the resources that you showed and how to download them or make them printable from the website.
So the resources are not printable from the website. And the reason for that is if you put things on the website and give them away, you have no way to know who's using them and no way to track them. So if people are interested in using the resources attached to the website, they would have to contact me and have an agreement set up. Again, it's just once you put things out there, you don't know how they're going to be used or who's using them. And so this is part of the way that we're trying to work with organizations that are interested in using our resource more so than just having it freely available.
That's fantastic. And I think you may be getting a slew of emails today from from the comments here, because I think that was the most the most frequently asked question. There's also a question around working with particular audiences, and I'm not familiar with this, but the Anabaptist communities where they have no access to online. How would you see opportunities to customize some of this information for communities that don't access online?
As you see, we have the handouts with the main points, which I'm not sure what you're usually using to support those families. So I think that I'm not exactly sure, other than the handouts that we have, what you would be interested in. I mean, as I say, many people still do love print material and books. That was something that really came out, that there's a value for that. Going completely online is not the only way to go. As I mentioned, we had our online resources for years, since 2014, but linking the online resources with print material was found to be of value. So I think the print materials, but again, depending on your interest or how you provide care to those populations, I think that you could explore or work with, if it was myself or whoever you're interested in working with, in creating the content necessary for that population.
I definitely think that's one of the skills of health units and public health nurses, is to really know their clientele and who they're working with, and definitely a skill set of many of the nurses that I've worked with. Another question is around what topics to talk about at different times during the perinatal period. And do you have any information that you would share around what to talk about at different times during that perinatal period?
Definitely. So part of this is sort of promoting breastfeeding in a way that doesn't elicit emotional responses. One of the things that when you were hearing from the parents and the healthcare providers is there's a lot of emotion around breastfeeding. And so our why breastfeed, we tried to make it really light. There was like, people were suggesting they wanted infographics, they want to be able to see snippets of information. So I think the why breastfeeding is really, and even in doing it, there were a few things that I found quite interesting. In relation to benefits for mom, like some of the cardiovascular benefits being communicated. So I think that prenatally, that's really important. Why I also do this work, stemming from my days working with parents, is the more they know prenatally, the easier it will be to use that information or understand what they learned when they're putting it to practice or seeing what's actually happening postpartum. So the whole how to breastfeed, I think, is really important. It's important to tell so that parents understand why, if they want to make that choice to breastfeed. Additionally, then they need to know how. And there's a lot of misconceptions. Probably the reason I started this work was I would teach prenatal education, and the first question every single class would be generally a partner putting up the hand and saying, a father many times, and saying, when can I give a bottle? And that really speaks to the fact that people don't understand how lactation works. And so the how will help them, if they've chosen why, just to understand the process, the physiological process, and how to support lactation. So I often would do that as well. I have always in my work, as you can see, worked with fathers and partners, and they are some of the population who is most appreciative of being provided with this information, as what I have found. I actually have also started working with grandparents, so that's been really exciting, and we just put a paper in to be published regarding that. So really it is about the whole family supporting mom and breastfeeding and the baby. And I think it's important to um, have information on how they can be involved. And so the Getting Help handout also has that. So I personally think, part of it is having people feel like it's something that they should look into ahead of time so that they understand a little bit about why it might be something they might choose. Secondly, how can they make this work for themselves and understanding how the physiology works. And then third, looking at how can the support be provided so that the parents all understand what their roles are and where they can access support as needed and how others can support them in their breastfeeding journey.
Excellent. Thank you for that. There's two more questions. One is we can do really quickly. One is about the QR codes, so to give to parents. And just for clarification, it would be best for people to email you directly for those.
Yes.
And a question around do you have a sense of how many health units or how many organizations are using this resource right now?
Well, I showed you the map, so I don't. And that's the problem when you put things out in the public. I don't have any. When I had put the other websites out over the past 10 years, I literally have no clue who's using them when you put them out that freely. We don't have anyone registered to use the website. We don't have any charge for the website. However, by having these handouts be something that people have to contact us and we know that they're using them, again, that will maybe change a little bit of how we're able to collect this information
Fantastic.
and track it.
The next two questions are similar, and they're both around the research that you're doing. One is maybe a little bit about the research and the website, but looking at how did you determine your approach for organizing the headings? Was that for ease of accessibility, searchability? Was that from families or from healthcare providers or researchers? Where did that come from?
Well, we looked at all of the data that when we looked at all of the different topics that were being covered, and then we had to figure out how to collapse them into different categories that made sense. And so we came up with the 5 categories that you see there. And I mean, many of them are fairly clear. That we did find that most of the categories, obviously the what to expect is quite a bit bigger. And then there are the headings at the top where people can search if they're interested in finding a specific heading. And there's a search feature on this website as well.
I kind of wish I could share so many of the comments that are in here as well, because there's a lot of comments from people that have been breastfeeding supporters at Halton Region is one of them. Just thinking about how this could help with lay home visitors and peer volunteers in different organizations. There's a few comments as well around some of the links that you have to the global health media videos, and that there's also a great app called Birth and Beyond, which is being used by nurses, and they just want other people to know about all of these great things, including using Google Translate to translate some of the websites. Is there a charge for using this resource?
There is not a charge, which again, and that's because I taught prenatal years ago, and I used to think, I can't believe people have to pay for this information, particularly breastfeeding information. You know, breastfeeding is one thing we generally don't have to pay for, and it was just a really big part, something I was very passionate about to get. I was also very lucky. I was working in the field. I knew all kinds of amazing experts in the field, and I thought I need to make sure other people have this information. So that's always been a big passion, as you can see. So it is freely available. I just, there's so many barriers that I've presented here today. The infrastructure around breastfeeding is just not, really needs to be looked at. And as I say, I'm so thankful to my partners, some of which might be on this call here today, for supporting this work and working with me, because we want to change the experience for parents, but also it's not just about parents, it's about changing it in the community. Breastfeeding is a word that is hardly even used, is not acknowledged a lot. And yet when parents have their baby and want to feed their babies, we need to make sure that they have what they need to be able to do that. So that's part of this whole project, is to make sure that we are putting breastfeeding at the top of our list of priorities, with everything else that's really important to parents, and doing everything that we can to make it seamless for them. Like everything in public health, if I don't hear about any problems, that means people have done exactly what they wanted and received the information they needed when they needed it to meet their own goals. So that's what we're hoping to do here.
And I think this brings us towards the end. Maybe we have time for maybe a question or two. But there are a few questions about PHN prep and how we could work together with you. And so I can definitely take that back to the PHN prep team. And I know that Jennifer is a great colleague to work with, as I've worked with her before. I'm sure that we could work together to see how we could have link some of this through the PHN website. And there's also a question around the community of practices. So we have community of practice, a number of different topics for community of practices through PHN prep, and maybe there is space for us to work together to create a community of practice around this work. Any thoughts on that?
I see this in many ways as a starting point. As I say, I think we're all trying to do the same work. The one thing I really don't like is everyone redoing the same thing. I'd rather we all work together and make it better. So I'm always very open to working with others with the same goal, and having this work, as I say, it's been freely available always. And other than the handouts, which now you would have to contact us for. But absolutely, as I say, I want an advisory committee around standardizing education that would be nationally, because again, one of the things we found is provinces do things differently, which doesn't always make a lot of sense either, when it's really the same information. That we should make sure that we have good, credible information for everyone to use that's being updated. So we update, we plan to make sure that the website is reviewed every 6 months to make sure that updates aren't needed. But generally, having done this in 10 years, not a lot changes when you're looking at very basic physiological information.
Thank you so much for that. That's great information. And we share your desire not to redo the work and duplicate the work that we're doing across the province. And I can see that in the comments as well. So as we wrap up today's webinar, I would really like to thank you, Dr. Jennifer Abbass-Dick. Thank you for being here. Thank you for presenting. I'd also like to thank Andrea Bodkin for co-moderating with me today, and a special thank you to everyone that came out to watch this today and the teams that are watching it together. You can expect to receive a brief anonymous survey for today's session. If you could please complete this, it helps us to improve the programming that we do. Thank you so much and have a wonderful day.
Thank you.